Good afternoon, folks. We've got B for you. B discusses discrepancies in healthcare when it comes to Black folks for elderly care. So we're going to discuss that this afternoon for the topic B for discussion B. So please join me in today's presentation B for y'all. Okay. The article discusses the significant health discrepancies faced by older Black Americans compared to their white counterparts. It highlights the Black Americans tend to suffer from chronic illnesses at higher rates, experience worse health outcomes, and have lower life expectancy. In 2018, the average life expectancy for Black Americans was 74.7 years, which was 4 years less than the overall average of 78.7 years. The COVID-19 pandemic further widened this gap, with Black life expectancy dropping 70.8 years compared to 76.4 years for white Americans and 77.7 years for Hispanic Americans. Several factors contribute to these discrepancies, including higher rates of hypertension, diabetes, and cancer among hold on. I get give me 1 second, guys. Paper wants to stick. Hypertension, diabetes, and cancer among Black Americans. older Black populations also experience higher mortality rates from conditions such as stroke, kidney disease, hypertension, and sepsis. The article attributes these health challenges to social detriments of health, which include unequal access to health care, healthy food, safe housing, and economic opportunities. These factors accumulate over time, leading to poor health outcomes in old age. Dr. Jessica Owens Young, an associate professor of health studies at American University, explains that Black Americans endure multiple harms throughout their lives, which take a toll on their bodies by the time they reach seniorhood. This phenomenon, often referred to as weathering, means that Black Individuals enter old age with more health challenges than their white peers. Black Americans experience higher rates of several chronic illnesses compared to their uh, com, compared to other racial groups. Some of the most common conditions include hypertension, high blood pressure. Black Americans are more likely to develop high blood pressure at younger ages, which increases the risk of heart disease and stroke. Then the other condition is type 2 diabetes. Black Americans are 60% more likely to be diagnosed with diabetes than white Americans, and they often experience more severe complications such as kidney disease and limb amputations. Okay, next page. Hold on. Okay. Right now. Obesity. Higher rates of obesity contribute to increased risk of diabetes, heart disease, and other chronic conditions. Chronic kidney disease. Black Americans are disproportionately affected by kidney disease, often as a result of hypertension and diabetes. Heart disease, a leading cause of death among Black Americans. Heart disease is often linked to high blood pressure, diabetes, and obesity. Asthma. Black Americans are more likely to suffer from asthma, which can be exacerbated by environmental factors and limited access to health care. Okay. Cancer. Certain cancers, including prostate and breast cancer, have higher have Black Americans have higher incidence and mortality rates among Black Americans. Okay, next page. Sickle cell disease, a genetic condition that primarily affects Black individuals, leading to severe pain episodes and complications. These discrepancies are often linked to social detriments of health, include limited access to health care, nutritious foods, and safe living environments. Accessing these issues, addressing these issues requires systematic change in healthcare policies and community support. The chronic illnesses disproportionately affected by Black Americans are influenced by a combination of biological, social, and economic factors. Here's a breakdown of the key causes. Okay, social detriments of health. Many health Many health discrepancies stem from systematic inequities rather than genetics alone. These include hold on. Economic stability, limited financial resources can restrict access to healthy food, quality health care, and stable housing for our housing. All healthcare access and quality. Black Americans are more likely to be uninsured or underinsured, leading to delayed diagnosis and inadequate treatment. Okay, neighborhood and environment, living in areas with high pollution, limited green spaces, and food deserts increases the risk of conditions like asthma, obesity, and diabetes. Education access and quality. Lower educational opportunities can limit health literacy, making it harder to navigate medical care and adopt preventative health measures. Social and community context. Historical mistrust of health of the medical system, stemming from unethical practices like the Tuskegee uh, syphilis study, can discourage Black Americans from seeking timely medical care. 2. Lifestyle and behavioral factors. Okay, diet and nutrition. Limited access to fresh, nutritious food can lead to higher rates of obesity, diabetes, and hypertension. Physical activity, unsafe neighborhoods, and lack of recreational spaces can discourage regular exercise, increasing the risk of heart disease and obesity. Stress, uh, stress and mental health. Chronic stress, often linked to racism and social economic changes or challenges, can contribute to high blood pressure, heart disease, and depression. Okay. All right. 3. Genetic and biological factors. While social factors play a dominant role, some conditions have a genetic component. Sickle cell disease, a hereditary condition that primarily affects Black individuals, leading to severe pain episodes and complications. Hypertension. Some studies suggest Black Americans may have a higher genetic disposition to high blood pressure through environmental factors play a role, play a significant role. 4. Systemic racism and healthcare discrepancies. Implicit bias in healthcare. Studies show Black patients often receive less aggressive treatment for pain and chronic conditions compared to white patients. Okay, medical research gaps. Historically, Black Americans have been underrepresented in clinical trials, leading to treatments that may not be optimized for their specific health needs. Addressing these discrepancies requires policy changes, community support, and improved healthcare access. Would you like to explore solutions or preventative strategies? Okay. Then you got more here. Black Americans experience higher rates of several chronic illnesses compared to other racial groups. Some of the most common conditions include hypertension, i.e., high blood pressure. Black Americans are more likely to develop high blood pressure at younger ages, which increases the risk of heart disease and stroke. Okay. Type 2 diabetes. Black Americans are 60% more likely to be diagnosed with diabetes than white Americans, and they often experience more severe complications such as kidney disease and limb amputation. Obesity. Higher rates of obesity contribute to increased risk of diabetes and heart disease and other chronic conditions. Chronic kidney disease. Black Americans are disproportionately affected by kidney disease, often as a result of hypertension and diabetes. Heart disease, a leading cause of death among Black Americans. Heart disease is often linked to high blood pressure, diabetes, and obesity. Asthma. Black Americans are more likely to suffer from asthma, which can be exacerbated by environmental factors and limited access to health care. Okay. Cancer. Certain cancers, including prostate and breast cancer, have higher incidence and mortality rates among Black Americans. Sickle cell disease, a genetic condition that primarily affects Black individuals, leading to severe pain episodes and complications. These these discrepancies are often linked to social uh, determinants of health, including limited access to health care, nutritious foods, and safe living environments. Addressing these issues requires systematic changes in healthcare policies and community support. Preventing, preventing chronic illnesses among Black Americans requires a multifaceted approach that addresses both individual health behaviors and systematic uh, inequalities. Okay, let's see. I'm gonna get the rest of these. Here are some of Here are some effective prevention strategies. 1. Healthy lifestyle choices. Balanced nutrition. Eating a diet rich in fruits and vegetables, whole grains, and lean proteins can help prevent diabetes, hypertension, and heart disease. Regular activity, regular physical activity, engaging in engaging in a in at least 150 minutes of moderate exercise per week reduces the risk of obesity, heart disease, and diabetes. Stress management. Chronic stress, often linked to racism and social economic challenges, can contribute to high blood pressure and heart disease. Practices like meditation therapy and social support can help mitigate this issue. Okay. All right. Preventative health care. Routine checkups, regular screenings for blood pressure, cholesterol, diabetes, and cancer can lead to early detection and better outcomes. Vaccinations. Staying up to date on vaccines, including flu shots and COVID-19 boosters, can help prevent serious illnesses. Genetic testing, a family history awareness, understanding genetic risks such as sickle cell disease can help individuals take preventative healthcare measures. Okay. 3. Accessing social detriments of health. Addressing social detriments of health. Improving healthcare access. Expanding insurance coverage. Culturally complement care and community health programs ensures better treatment and prevention. Okay. Give me 1 second, guys. Okay, so enhancing food security, tackling food deserts, and increasing access to affordable, nutritious food can reduce uh, diet related illnesses. Safe and supportive environments, reducing exposure to pollution, unsafe housing, and uh, violence improves overall health outcomes for community and policy and incentive and initiatives. Health and education programs, community-based initiatives and that promote nutrition, exercise, and disease prevention can empower individuals. Advocacy for health equality, supporting policies that reduce healthcare discrepancies, improve economic opportunities, and address systematic racism is crucial for long term change. Okay. For now, Gator Wellness, take care, folks. I'll be back on with C later. I'll see everybody later for C. For now, Gator Wellness. Take care, folks.